Hi, I'm Dr. Pavitra from Dr. Smile Fresh YouTube channel. Today we are going to see about personalized medicine. Is it the future of healthcare? So personalized medicine, it is also known as precision medicine. Traditionally, most patients with the same disease receive the same treatment. However, not everyone respond in the same way. One medicine may work well for one patient but may be less effective for one or even cause side effect in another person. This is where personalized medicine play an important role. So let's see what is personalized medicine. So it is a healthcare model that tailor disease prevention, diagnosis and treatment to the unique genetic, molecular and lifestyle profiles. Instead of relying on a one size fits all approach, it utilizes personalized medicine. Why it is important? Right treatment for the right person. Improve treatment effectiveness. Reduces side effect. Support early disease detection. Help prevent diseases. Improve patient outcome. Enhances quality of life. Next is technologies driving personalized medicine. Several advanced technologies make personalized medicine uh, impossible. So first one is genomics, that is genetic testing. Here we are doing DNA sequencing, human genome project and identifying disease causing genes. Example, testing for BRCA1, BRCA2 mutations to assess breast cancer risk. The second one is pharmacogenomics. So what is pharmacogenomics? It is studying how genes affect a person's response to medicine. It helps doctors choose the right drug and dose. Example, some patients need different doses of warfarin based on their genetics. The third one is biomarkers. So biological markers in blood, tissue or genes. It is used to diagnose disease and predict the treatment response. Example, HER2 biomarker in breast cancer determine eligibility for targeted therapy. The fourth one is targeted therapy. Drugs designed to attack a specific molecule involved in disease. Targeted cancer therapy that work only for patient with certain genetic mutations. The fifth one is artificial intelligence, that is AI. So it analyzes large amount of patient data and it helps predict disease and recommended treatment. The next one is digital twin, a virtual model of a patient created using a medical data. Doctors can stimulate treatment before applying them to the real patient. Seventh one is wearable devices, smartwatch and the health trackers. It continuously monitor heart rate, blood glucose and activity and sleep, etc. And the eighth one is big data and electronic health record. It combines clinical records, imaging, laboratory result and genetic data. And it support personalized treatment decisions. The ninth one is predictive analysis. So it uses AI and patient data to predict disease risk and outcome. And the 10th one is regenerative medicine. It includes stem cell therapy, tissue engineering and gene therapy. It is an emerging department. So among all these technologies used in personalized medicine, I choose to focus on digital twin because I found it particularly fascinating. Let us explore it in detail. So what if doctors could predict the best treatment for you before you even become the seriously ill? That is the promising of personalized medicine. So in these all the topics, I personally like the topic of digital twin. So let's see what is digital twin. So it is a virtual representation of a real patient, organ or body system created using clinical data and artificial intelligence. So this virtual model help doctor predict disease progression and personalize treatment before treating the real patient. So here I am also having same doubt like you, that digital twin and cloning are the same. Digital twin and cloning are not same. Definitely it is not same. Digital twin is a virtual model, cloning is a biological copy. Digital twin uses AI and patient data, exist inside a computer, predict treatment outcome, support clinical decisions. In cloning, it uses genetic sensors, it is in living organism or cells, creates identical organisms, mainly used in biological research. So applications in healthcare. So it is used in cardiology. The digital twin used in cardiology in heart failure cases and cardiac resynchronization therapy. In oncology, it is in personalized cancer treatment, radiotherapy planning, and in neurology, stroke, Parkinson's disease. In orthopedics, joint replacement planning and rehabilitation. And drug development, virtual clinical trials and personalized drug testing. Next, I'm going to add one more topic about one. I review one clinical trial. Let's see what it is. So, the clinical trial, the topic is MRA allocation of pacing target in cardiac resynchronization therapy. It is the real clinical trial that support digital twin. There are many clinical trial that are supporting digital twin. I review this trial. So let's explore this trial. Background of the study: patient with heart failure do not always respond well to cardiac resynchronization therapy because the pacing leads may not be placed in the most effective location. Researchers developed a 4D heart model using MRI images to create a virtual representation of each patient. This model helped doctor identify the best locations to place the pacing leads before the procedure. The aim of the study is this is the multi-center randomized clinical trial is to determine whether digital twin guided lead placement is safer and more effective than the standard method. In short, I prepare some points in this study. Let's explore it. The study design component and the design. So here the study type is interventional. Allocation is randomized. Interventional model is parallel assignment. Masking, that is blinding. Here the blinding is triple. What is blinding? Basically, participants and the investigator and the care provider, they don't know who we are treating and what type of treatment we get. So here that participant, care provider and investigator, the three peoples are don't know what they are receiving. So this is called blinding. Here the blinding is triple. The primary purpose is obviously treatment. The study population clinically accepted for CRT device implantation, because we cannot use volunteers in this healthy volunteers in this case study. So who need treatment, we can take that as participant. The sample size is 210. Follow is 6 months. The study center is multi-center. Study duration is 2014 to 2023. So the primary outcome is improvement in left ventricular ejection fraction after 6 months. The secondary outcome is if there is any heart failure hospitalization, if any impact on the quality of life and exercise capacity, 6-minute walk test, and safety and procedural complications. The study status is the study is completed and the final result have not yet been published. So, the future of digital twin technology in healthcare. More personalized treatment plan, better disease prediction and prevention, integration with AI and wearable devices, support for clinical trial and drug development, improved patient care and decision making. What are the limitations? So, high cost, limited availability, privacy concern, ethical issue, need for advanced technology and trained professional. What is the conclusion? So, personalized medicine is changing modern healthcare. Digital twin are a promising innovation. They help deliver safer and more effective treatment. More research is needed before widespread adaptation. I believe personalized medicine will play a major role in improving healthcare and patient outcome in the years to come. So, if anybody interested, can check clinicaltrial.gov. I give that ID number. Please check that clinical trial. Reference from National Human Genome Research Institute and clinicaltrial.gov and nature.com and National Institute of Health. Thank you. For more videos, please follow and subscribe Dr. Smile Fisher YouTube channel.